Hi, my name is Cassandra Delgado. I'm a certified prosthetist orthotist and director of clinical education with Coyote. Today we are going to be talking about the Wave Suction Band. This is an excellent option for individuals who maybe not fit perfectly within the profile of a suction liner, that you need some adjustability. So perhaps a different liner size or style to ensure optimal suspension for your individuals. In the package with our large wave suction band, we have the CD130BL, and in this package comes the band itself made out of silicone and 2 ounces of silicone adhesive. Today we're going to look at how to practice making sure that this is going to bond well to the liner that you're using for your patient, and then showing exactly how we want it to bond onto the liner through a full setup of steps. So typically I start with the top little edge of the liner that I have cut off, just the extra length, to ensure that this is going to adhere well. Some liners will come with some type of coating on the outside of them, so we just want to make sure that once we do bond our wave suction band that we have optimal adhesion and it does not come off. How I generally like to prep is just a little bit of rubbing alcohol before. We want to ensure that there's no areas that have any film or any type of oil on it. So we want to make sure we do this ahead of time, and that we would also take some type of tape to remove any potential lint, dust, dirt, anything from packaging that might be in here. So we'll let this dry for a few minutes, and then we'll come and put a thin layer of our silicone adhesive onto it, just to ensure that after this cures, we're not able to easily rub the adhesive off of the liner and deattach it. So now that we have prepped our surface and we are ready to do our test patch, we are going to take our silicone adhesive. Now it's 2 ounces, which is more than enough for proper adhesion for your band and a test patch. So what I'm going to do is just make sure that I go over any areas that might have different fabrics. So sometimes an anterior to a posterior, sometimes a seam. We might have different fabric weaves on our liner. So just putting a good layer of it and little test patch. I don't want to make it too thin because I want to see if I can pull any of this off. Now you have about 20 minutes of working time depending on your conditions, but a thin patch layer like this, we want to just keep an eye on and make sure that we don't have this peeling off after it cures. So we'll just let this sit for about 20 minutes just to ensure that we have optimal adhesion on our liner before we bond this to our patient's full liner. So we're going to take a look at our test patch here. We're just going to pull some tension on it, ensuring that we're not having any wrinkling there. And then on our edges that we've smoothed out, just checking and seeing if we can pull up any of this in the direction that the socket would be donned, right? So in this direction, I'm not having any coming off here. So we have really good adhesion, and this has only been after about 20 minutes. So this is what we're looking for. Again, we are bonding these to fabric-based liners to ensure that we have optimal adhesion. If we bond it to a liner that doesn't have fabric, there's a very high risk that it will not have good adhesion just because of the different properties manufacturers will put on the outside of their liners for those that do not have fabric. So currently indicated for fabric-based liners, it can be used for various amputation levels, including transtibial, transfemoral, or any different upper extremity amputation levels as well. During our check socket fitting phase, we want to ensure that we are choosing the proper size wave suction band. So with this, we currently offer 4 different sizes, ranging from 23 centimeters of circumference measurement all the way up to 62, so quite a large range for your individuals. Today I'm going to be using a size large, which accommodates circumferences from about 30 to 38 centimeters. When you have your wave band, you want to ensure on the patient it's not covering any prominent bony anatomy, and really trying to keep as much of a circumference that is very circular in shape if possible. Now, if someone is more bony and has more of a triangular shape, suction is still an option with this, but ensuring that we have a nice snug fit for those individuals. We also want to ensure that our wave band never comes along any trim lines where an air leak could possibly happen. So we want to ensure that we are distal on our attachment to our wave band from any trim lines, specifically the posterior kind of popliteal trim line. So with our wave suction band, we want to put it on a model that is approximately the size of our patient's limb and shape. So with this, during our check socket fitting, I'm going to measure the patient's limb with their liner on to get my band size. Then once this is on a patient's limb, so if this was my patient and during our fitting, this was an optimal place for it, I'm then going to measure over this band a little snug just to ensure when I am adhering it that I have the proper amount of tension on this fabric and the proper amount of tension on the wave band when we glue it. We don't want it to be overstretched because when we put it on the patient, that overstretched band might pull in a little too tight. And then obviously we don't want it too loose as well. So right here for this model, I am measuring right at 38. So if this was my patient, I would want to ensure that when I put this on a model that I have that 38 circumference for my wave band. Sometimes if I have an individual who has a very fleshy limb, then I may also measure at my proximal edge and then as well at my distal edge to ensure that I have a good taper as well. Again, just depending on their limb shape and presentation. So we want to make sure that we prep this for proper adhesion as well. So typically during my check socket fittings, I am marking exactly where this band is on the liner. So giving myself a few little permanent marks. We also want to ensure that we prep both the wave band and the liner itself. So for prepping the wave band, we just want to remove any dust, dirt, things that might have gotten on it. So I do like to just spritz this with a little bit of rubbing alcohol and just let this air dry, ensuring that we don't have any hair, dirt, lint, dust, anything like that on it. So we'll let that dry. And then for our model, we want to prep this as well. So again, we want to remove any of the little dirt areas, lint that might have gotten on here. So any kind of stick tape and just go over our area pretty well, removing anything that could possibly cause a bonding adhesion. Yeah, I just picked up a few little fuzzies along the way. All right, so that looks pretty good. And then with this, again, if there's any oil coating on a liner, that might cause an adhesion problem. So just ensuring that we give this a good mist. To ensure that we don't have any of that could possibly cause our wave suction band to become unadhered. So with this, we're going to let this fully dry before we do any type of adhesion. So at least a good 5 minutes, you want to ensure that this is completely back to the same color it was before you sprayed your alcohol spray. So at this stage, we have fully prepped our fabric-based liner for the wave band adhesion. We've cleaned our wave band and we've cleaned and prepped our liner surface. So you can see I've made little marks where I want my band to be bonded to. And in these marks, these are the thickness or the width of the wave band, which is about 7 centimeters. So that's the height we're kind of looking for. And at this point, we are going to want to tape off our area for where we are going to bond our silicone. Now, typically what I like to do is take my band and just bring it up and out of the way so that I don't have to worry about moving it after I've put my tape on. So we want to tape above and below, and what this is going to allow us to do is have a nice clean edge for our patient's liner in the end so that we don't have a silicone mess. We want to keep it nice and clean looking, professional. So we want to tape off approximately 1/4 inch above where our band is going to go, again to leave that nice clean edge. So I'm using these marks as a reference, proximally and distally, and with these we'll be able to go in a nice circumference. You want to make sure that your band is pretty even around the limb and that we have a good seal happening. So again, about 1/4 inch above, 1/8 to 1/4 above where your band is going to go. You want to pull this tape fairly snug because you don't want, again, the silicone to kind of permeate through it and then become kind of a mess for your patient underneath or not have a nice clean edge to it. All right, so about there is good for our proximal area, and then we'll do the exact same distally, leaving approximately 1/4 to 1/8 of an inch of space for our glue to fully cure underneath that wave suction band. So again, using my little reference marks here, pulling my tape fairly snug. And that should about do it. Now at this point, we're going to get our 2 ounces of silicone adhesive. We're not going to need to use the whole bottle, but we do want to keep this after we're done with this whole process in case we ever need to have a little patch to a corner that may pull up. Unlikely to happen, but in the event, we always want to make sure that we keep a little bit left over. So for this first part of the bonding process, we are going to open up our silicone, and put a generous amount because any excess is going to go on our electrical tape here. And then we are going to work on smoothing this all throughout and making sure that this fabric is well saturated. We want a nice smooth layer. So we're not putting it on the band, we're putting it directly onto the fabric. Then we are going to take our tongue depressor or similar and start working this nice and evenly. We may need to add more, we may need to pull off some excess. So we'll see as we go how much we are needing. So I think for this size limb, we are going to need a little bit more to ensure good even saturation. So with this, you've got about 5 to 10 minutes of working time with this silicone. I'd say you've got about a good 5 minutes. So let's get some more on here. So silicone will bond to silicone. So if there is an area that you find you didn't saturate as well, you can always go back after the fact and add a little bit more to an area. What we just want to ensure is that we have very smooth silicone. Any area that kind of bubbles up or has a area that's not as smooth could be a point when a patient is donning a socket that could pull up and cause the band to kind of wrinkle. So we just want to ensure everything is really smooth, no lumps, no bumps. So I'm really making sure that all of my edges are well saturated, and you can see I'm going on my electrical tape some as well, because when we pull this tape off, we're going to have a nice clean edge. So this liner has good stretch to it, and the fabric on it is a little more porous. So I know I'm going to get good adhesion just based on the weave of this liner really accepting this silicone gel as well. So this glue it's going to bond well today. All right, so this looks like some pretty good coverage so far. All right, looks great. So at this point, I have my band, and I'm going to flip it over my edge. And then because we're still able, and we still have working time with our silicone, I'm just going to make sure that this band is not in contact with any of our electrical tape, and it's going over those little marks that I had made previously. Now, you'll start to see a little bit of white underneath your band. Those are air bubbles, so we're going to make sure that we push all of those out once we have really good placement. So we're going to go around and ensure that these air bubbles are being pulled out. Okay, so before I pull off my tape, I am making sure that I don't have any wrinkles, that my wave suction band is not in contact with my electrical tape anywhere, so when I pull that off, I'm going to have a nice clean edge. Now, you can use, at this step, just a tiny bit of rubbing alcohol if you have areas that you're having a hard time smoothing, but we do want to just come back over this edge and just make sure we have really good adhesion. And it is okay if some of this glue is going over top of the band. We're going to do a second layer that's going to sandwich that band in between the two. So just ensuring that as you smooth this, you know it's completely fine for it to go on top of the band right now also. So just very smooth. We don't want any big clump of silicone that could cause the band to lift up as we work around. Now, at this point, we are going to take off the electrical tape here. And what we should have underneath is a good first clean edge. Looking great. And then we're going to do the same on the bottom and just let this cure pretty good. So it'll be still a little tacky after about 5 to 10 minutes. But again, the next path that we do over this, the silicone is going to bond to the silicone. So here we're going to be able to ensure that we've got a really good coverage in between the two layers. So we'll let this sit for a little bit, just again making sure that we've got a good saturation, that we've pushed most of those air bubbles out, and then we'll come back to it in just a few and do our second final little sandwiching coat in between. So we've already done the first application of the silicone glue with the wave band. Now we are going to ensure that we securely place that wave band onto the liner with one additional layer that is going to essentially sandwich the wave suction band in between two different layers of the silicone glue. So what I'm doing is placing the electrical tape just a millimeter or two above where my initial tape was. Again, just to ensure an optimal bond here, and I'm pulling this really tightly as I go around, just so we have a nice clean edge for when the patient is using this day to day, that we don't have any areas of silicone that want to pull up. Now the proximal area usually isn't one that you might have some unadhesion to. It's the base area. So although we're paying really close attention to both, the base area, as they slide into the socket, this is the region that's going to have the most friction on it. So we just want to ensure that we are paying real close attention, especially on this distal aspect. So we don't really want a thick glob, right, of silicone. We want a nice, even, tapered, thin layer. So at this point, I'm probably a solid 1/4 inch away from my wave suction band, both superiorly and inferiorly. All right, this is looking pretty good. So at this point, our silicone that we put that first layer might still be a little bit tacky. That's completely okay because the silicone is going to bond to itself. So I'm just going to run a really thin bead across our top area where we have the edge that bridges from the silicone to the fabric here. Okay, so that's about good. We can always remove any of the excess and just make sure you cap your silicone so that next time you go to use it, you're able to, and it hasn't cured up inside of the container. All right, we'll take a new clean tongue depressor here and just sandwich it. I'm going on the actual wave band by, again, about 1/8 of an inch. I'm not really wanting this silicone to touch any of my waves in the design. So if you do get an area that you've kind of put a little bit too much on, feel free to take some rubbing alcohol to it to just remove some of that excess silicone that may have gotten on there. Working this around really, really clean. Nice and thin, even pressure on this distribution. That little bit just got a little close there to my bands. Okay, that looks great. And then same to this distal area, just making sure we have a little bit on our band itself so that it's between the band and the fabric. All right, then I'm going to take this edge, let me actually just grab a clean one, and go over the both of them, making sure that they are nice and smooth. And again, if you find a little area later on that maybe you missed or didn't get great adhesion on, you can always come back, add a little silicone to that area, and grind it. Now the last thing that I do is I'll use a spray bottle or maybe some rubbing alcohol to then do a nice final removal of any excess that we have here. So here I just slightly missed my fingers because I want to make sure that my gloves glide across this silicone, right? Just a little more mist. And this will just ensure that we don't have a lot of bumps in it. Now typically I would not recommend using any kind of like petroleum jelly or Vaseline to do this, just you don't want to interfere with the curing of the silicone, so a little rubbing alcohol is going to be our preferred method. All right, this is looking good. Okay, so at this point now, I'm going to remove our tape here. Just ensure that you don't accidentally snip your liner or your wave band. Just be a little careful. All right, beautiful clean edge. And then same here. So with this, I really want to make sure that this fully cures before I have a patient don it into a socket. So I like to set these overnight, make sure I give myself plenty of time, and then let us have full adhesion here. So far, this is looking really, really great. You can always find more instructions in the information on our website. So feel free to visit us at coyote.us to check out our full product line and how to ensure that you have great optimization when using our wave suction band. Now the last small step that we want to do after we've bonded our wave suction band on and removed that electrical tape is just go through and slightly knock off that edge of silicone. So you'll notice that you have a good clean edge. We want to keep that, but then just slightly bevel that outer edge to ensure that we have no little lip that could possibly peel up here. So you want to still do this while your glue is workable. And again, just a very light touch to knock that corner off that our tape has left behind. So just working my way around, and I'm just using the tightest radius of my tongue depressor here just to knock off that slight little edge. Do the same on this side. All right. So as we just do this slight little path all the way around, we want to ensure that we have, just looking at our wave band, that we have a nice, good, even coverage. Nothing that's going to cause a problem for donning. So at this point, I'm going to let this fully cure overnight before I have a patient don it and put it into their socket. So this is a great way to add some additional stabilization in a socket, help control rotation, or use it as your primary suspension method in a suction or vacuum system. Now, feel free to check out our website at coyote.us, where you can find any of our upcoming webinars, events, and a full educational section at Q School, where you can find many more courses that will help you ensure that you have optimal outcomes while using Coyote products. Thanks so much.